today's current environment of patient care and patient safety. Now, a lot of what happened in surgery concerns ideas and imagination. And I'm sure you've heard the quote that imagination is stronger than knowledge. And a lot of the things that these pioneering surgeons did was basically a lot from their imagination and thought before the knowledge came through. Okay, so you know the word surgery? It comes from the ancient Greek language meaning hand labor. Surgeons used to perform by hands. And perhaps the first surgical techniques were developed in the battlefield related to treating trauma and injuries. And the oldest operation in existence in history is the burr hole. The Greeks made burr holes. There are historical evidence that they created holes in the skull. Why they did that, I don't know. Did they have the knowledge of an extradural hematoma? Nobody knows. But trephining was one of the first operations that was developed by the Greek. There is history of surgery from various old civilizations and cultures such as Mesopotamia, Egypt. And there's a great history of surgery in this Indian subcontinent. And Sushruta is considered to be the founding father of surgery. And you can still find some of the old writings which describe his work, and it's interesting to read how surgery was carried out in those days. Greece, or the Greeks, contributed a lot. You're familiar with the Hippocratic Oath, with Celsus, with Galen, with those of you who are in third year and studied and read inflammation are familiar with tumor, calor, rubor, dolor, redness, tenderness, heat, loss of function, the classical signs of inflammation which were described to us by the Greek. And then obviously the Middle Ages, where a significant amount of work was done by scientists like Al-Razi, Avicenna, who did a lot of work in developing surgery. And then Renaissance in Europe and early modern Europe, Vesalius, who did the early dissections on human bodies. And a lot of these dissections were done on condemned prisoners. And it's very interesting that the word theater actually comes from where they would do these things. And these were entertainment. People would actually go to these theaters to watch these anatomists dissect the human body. And a lot of criminals and a lot of condemned prisoners had their bodies dissected early on and in the quest for learning the anatomy. And Vesalius was one gentleman in the University of Padua in current Italy who performed some of the dissections, early dissections from which we know our current anatomy. Parr was a French surgeon. He treated a lot of battle wounds, and he first devised the concept of how to wash and clean a wound. Before that, they would put boiling and burning oil on these wounds in battlefields to stop the bleeding and cauterize the wounds. And then we come down to people who you have read about. You've read about John Hunter, Percival Pott, whose Pott's disease, or described a lot about tuberculosis of the spine. And then James Syme, whose Syme's amputation is still performed by general surgeons, especially a lot of the work which we still do in this part of the world is the Syme's amputation, where you have a walking foot. But till this time, till we were here, surgery was still dirty work, and it was the age of agony. Patients would be tied down, they would be strapped down by assistants of surgeons who would then carry out and perform these procedures. And because of the pain and the death from surgical work, most surgeons confined themselves to the outside of the body. It was just treating injuries, and the most popular operation was to amputate a limb. And there were surgeons who claimed authority on amputating limbs. And this concept of infection was unknown till a gentleman in Hungary by the name of Semmelweis first realized that you reduce the mortality if you wash hands or if you wash yourself. And people would ridicule him. He was ridiculed by the medical community for advising to wash hands before you perform surgery. But despite the ridicule, he made it compulsory to wash everyone hand before entering the maternity ward, and this brought down the maternal mortality in Hungary in some of the Hungarian hospitals. However, where surgery is today starts with this story, and I'm going to tell you this story and a little bit of detail because it's a very interesting story. You know, hospitals in London, in the UK, they started establishing teaching hospitals in the early 18th century. In 1821, they opened the Charing Cross Teaching Hospital, and that was followed by the other famous London hospitals. And this particular day, 21st December 1846, is a very famous day because in one of London's teaching hospitals, the University College Hospital, and some of you still go and visit this hospital, hundreds of people were crowded into that operation theatre, where the city's most famous and renowned surgeon was going to enthrall the audience by showing them a mid-thigh amputation. And people would actually jostle and push for seats in this operation theatre. And the theatre consisted of a stage, that's why we have the name Operation Theatre, with a semicircular stand, and in the middle of it was a wooden table, which was stained with blood from past surgeries, and the floor was full of sawdust, and sawdust was there to absorb all the blood and fluid which would fall out from the patient. And the screams from the theatre, they say, would mingle with all the sounds coming out from the streets. And to most surgeons who were practicing surgery and most patients, surgery was to be avoided at all costs because of a very, very high mortality. And hospital mortality in surgical was so high that even the famous nurse Florence Nightingale wrote that the patient is better off at home than being in one of these hospitals. Because when you were in hospital, it was death. So the surgeon this afternoon was a tall, 6'2" gentleman by the name of Robert Liston, a famous man. Now remember, this morning we were talking about stunted growth. And growth all over the world, especially in the Western world, has improved. And people in the UK, he was 8 to 10 inches taller than the average person in the United Kingdom at that time. So this tall gentleman, whose famous stories you hear when you visit the Royal Colleges, was going to perform an operation for the first time, and the substance he was going to use was ether. Ether had been discovered a couple of centuries earlier when a German scientist added sulfuric acid to ethyl alcohol, and he knew that he fed it to his chickens, and he found that the chickens would go to sleep and then they would wake up unharmed. So he thought about this, but it took 2 centuries before a gentleman in America by the name of Crawford Long painlessly removed a tumor from a patient's neck. However, like all of us today, if you don't publish, you perish. He didn't publish his report, and credit goes to William Morton in 1846, who extracted a tooth under the influence of ether. As this, he was the first gentleman who used ether. Although Joseph Priestley in 1772 had recognized nitrous oxide as a painkiller, but it was considered too dangerous and unstable to be used. So, in the United States, this development is what changed surgery, and this is what he was going to do this afternoon in this hospital in London. And he called it Yankee Dodge. And he said, gentlemen, today I'm going to use Yankee Dodge because it came from America. And Liston was considered to be the fastest knife in London. And the stories about Liston. And he would amputate a patient's limb in 14 seconds. He would ask patients to take out their pocket watch and time him. And his pride. And you know, there are 2 very, very interesting stories about this gentleman. And one of the stories is that while doing an amputation, he took off the patient's leg and the patient's testicles in the same operation. So swift that the knife just went round the thigh and amputated everything. The other interesting story is that once while operating and in his earnest for speed, वो लिखा होता है ना यहाँ रोड पे speed thrills but kills. So in his earnest for speed, once while doing an amputation, He cut off the fingers of his assistant because the assistant would have to press on the femoral artery with his fingers while the surgeon amputated the limb. So he cut off the fingers of his patient, and while swinging the knife flew from his hand and hit one of the other persons in the theatre who was observing the operation. So the patient died of sepsis, the assistant whose fingers were cut died of sepsis, and the person who was hit by the knife died of probably a myocardial infarction or a heart attack. And I think this is the only incidence in surgery which has a 300% mortality. So, this day, under the use of ether, I've seen the device. The device that he brought into theatre for give ether looked like one of the hookahs that we use. And he placed the crude mask over the patient's face, and he carried out this amputation. And they say this amputation under ether took him less than 60 seconds. And when the patient woke up a few minutes later, he neither had pain during the procedure nor any discomfort, and the age of agony was nearing its end. And this is when we actually step into what today is known as modern surgery. It is this development, and one of the gentlemen who was there in that theatre that day watching this operation was this man who you're all familiar with, a person by the name of Joseph Lister. And Lister was to witness this spectacle in the afternoon, and he ran out of the theatre in enthusiasm, announcing to his colleagues that I have seen something very spectacular today. The other gentleman who was here watching these amputations was a person by the name of James Simpson. And James Simpson was so horrified by what he saw in this operation theatre that he decided to run away and become a lawyer. Fortunately for you gynecologists sitting over here, he came back to medicine, and James Simpson, as you all know, is one of the most famous. I think some of your things and devices are from James Simpson. And then the work of Lister. This is the second greatest development that made surgery safe for the modern era. Putting the patient to sleep